I'm Nancy Baumgartner. I'm a licensed clinical social worker. I've been working with kids and teens for a bit over 30 years now. And this presentation is called Written Off, and it deals with the impact on kids and families when tick-borne infections, or TBIs, are left undiagnosed and untreated. That it's tick-borne infections specifically for this presentation, but it really could go for other infections that are not looked for and therefore not diagnosed and treated that can cause psychiatric symptoms. All right, so I thought I'd start with some common baseline assumptions many people hold about kids and teenagers. Typically, they're seen as people who are dramatic and exaggerate, they're easily influenced, they're manipulative, they don't want to talk to adults, they're always trying to get over. I really hate that expression, but I hear it used on a pretty regular basis. They hide and lie to get their own way, they think they know everything, they're too young to know what they're thinking and feeling. It's very hard to be believed under those circumstances when that's the baseline assumption about. So, primary domains and corresponding tasks and expectations for people at this stage of development, kids and teenagers. In the family domain, keeping and cooperating with the schedule, interfacing with family members and participating in assorted activities, learning to manage age-appropriate household and self-care, and the degrees of expected responsibility will vary depending upon the family and their challenges and lifestyle. Education, complying with schedules, paying attention in class, focusing on and completing assignments, taking tests, engaging with others cooperatively, managing impulses, regular attendance in school, various activities, participating in extracurricular activities, athletics, and getting up early. Social, being available for events, visits, and assorted gatherings, engaging in sports and activities. And this is a list of common tick-borne infection manifestations in kids and teens, in anybody really, but for the purpose of this video, it's restricted to kids and teens. Severe fatigue unrelieved by rest, insomnia, I know they don't seem to go together, but they do, it depends on the individual. Headaches, nausea, abdominal pain, impaired concentration, poor short-term memory, inability to sustain attention, difficulty thinking, expressing thoughts, noise and light sensitivity, panic and anxiety attacks. I see an awful lot of that. Difficulty reading and writing, being overwhelmed by schoolwork, difficulty making decisions, confusion, uncharacteristic behavior, that runs a whole gamut, outbursts and mood swings, fever, chills, joint and or muscle pain, dizziness, rashes. And these symptoms were taken from Dr. Charles Ray Jones' list of symptoms. And that's not to say that anyone with these symptoms or a collection of them is infected. It's just that these symptoms are common to kids and teens who are infected. That doesn't mean they're caused exclusively by tick-borne infections. All right, when symptoms are caused by undiagnosed and therefore untreated infection, well-meant attempts to help accumulate and yield a diminished, defeated, and perhaps ended life. This presentation was created for a medical conference, and the doctors went into the details about the testing inaccuracies for tick-borne infections and the medical aspect of it, which I didn't do here. So you're free to research that on your own because there's a great deal of information available on that subject, but I'm not going to cover it here. So suffice it to say for now, because of testing, inaccuracies and much confusion, often tick-borne infections go undiagnosed, undetected, undiagnosed, and therefore untreated. Okay, so these are some coping mechanisms kids utilize for symptom management and relief. Video games, internet chat, television and internet videos, music using headphones, that shuts the world out, isolation, refusing to engage with others on a consistent basis, and go places that should be pleasant. I've seen some real knockdown dragouts over going to pleasant places like the beach or, a mall, and a kid just didn't want to go. And it didn't seem to make sense to parents. And it doesn't if you don't know what's going on. This can appear unreasonable and defiant. Staying in bed excessively, sometimes all day, and some self-medicate with drugs and alcohol. And all these things can happen with non-infected kids, but it's to what degree they're engaged in and what purpose they serve in each individual case that's key. So it's very important to not paint with a broad brush and to listen very, very closely and look for details. All right, this is a real kid who was referred to me. At the time, I had a position in a high school doing, garden variety counseling, crisis intervention, anyone that came through the door. And this 16-year-old boy, Charles, was referred to me for management of panic and anxiety attack, bouts of rage and crying, depression, and grief over a recent romantic breakup. His symptoms included, and many of which began when he was 13, so it wasn't, new. He started an onslaught of symptoms. Sometimes it begins gradually, sometimes, it's dramatic, depends. Migraine headaches, recurring rashes that look like stretch marks on his torso, frequent sinus infections, inability to focus, intermittently passing out with physical exertion, sleep issues, primarily many hours of non-restorative sleep in Charles' case, severe fatigue. He had 2 bouts of mono over 2 years' time between freshman and junior year. Okay, so this impacted Charles' life in his family domain. Parents were kind, but they were exasperated and intently focused on Charles' attitude. That happens a lot with kids. Watch your attitude. You have a bad attitude. Change your attitude. Check your attitude, and so forth. And they were extremely concerned with his lack of interest in the SAT. The SAT was a huge thing with these folks. Charles was described to others and to him. He's smart but lazy, overly dramatic, needs motivation, he's avoiding work, he's scared to grow up, works himself up, needs to push himself, and he's milking his illness. In Charles' educational domain, he received a 504 plan due to migraines and anxiety attacks. A 504 is an agreement that a kid needs accommodation for a period of time, and it's due to something that's passing, that's temporary, an illness, whatever it may be. So the school knows to allow for certain things for that kid. Oh, and teen anxiety is often seen as social anxiety, and some people really take that diagnosis seriously. This is social anxiety, and the focus gets on that, social anxiety. We need to force them into social situations. It's very interesting how a term that's also a diagnosis can take off. It's like unleashing 1,000 horses to run in a certain direction, and few things get paid attention to other than that diagnosis. Anyway, Charles was seen as one who abuses the nurse's office, avoids social situations like pep rallies in the cafeteria, needs to be forced to participate, needs to face his fears. Too many absences and tardies, may lose credit, not graduate with class. That's a sword of Damocles that is intended to incentivize and warn and oh, you're not going to graduate. Everybody wants to graduate, so you're going to do it, right? You're going to do your work. He's not working up to potential, is getting out of class by going to the counselor. Counselors always know that. They always know who's trying to get out of class. But anyway, he needs to be pushed, is test avoidant regarding the SAT. So that's the lens through which he was viewed at school. In Charles' social domain, his friends they grew weary of broken plans. He was unable to do much but hang out, so, the fatigue. He became boring. Friends concerned about but tired of his negativity. So he could have mood swings. He was prone to mood swings and tearfulness, very frustrated a lot of the time, aside from feeling sick. Over time, kids moved along with their activities and simply were not available. It wasn't that anyone is doing anything wrong or mean. They had things to do. They, clubs and sports and theater, all these things. So they weren't available. Some kids concluded he wasn't cooperating with the help he was getting because he was getting a ton of help. He was, a lot of attention was being paid to what was going on, and nothing seemed to help him. So it had to be him. It had to be he wasn't cooperating. Sporadic school attendance took Charles out of social circulation. He couldn't be an active member in sports or other extracurricular activities. He was very social at one time. He became social again, but you'll see. That was his story at school, the social domain. Now, he had a medical and mental health domain because of his, symptoms and his mental health situation. And over the years, Charles was diagnosed with and treated for major depression, generalized anxiety, sinusitis, hypertension, GERD, migraines, hypoglycemia, and ADD. All his blood work was normal, Lyme tests were negative, medications yielded little difference in symptoms. Many became worse and new ones manifested. So therefore, it's psychosomatic. He's doing this to himself. Mental health interventions included 2 hospitalizations for suicidal ideation, participation in intensive outpatient programs in hospital, and in an alternative school for emotionally disturbed kids, ED, emotionally disturbed. The conclusion was that he needed to embrace his mental illness, use his coping mechanisms from his toolkit, avoid screens, and force himself to face his fears. He was written off. So in the conclusion, he went to programs that offered cognitive behavioral or, dialectical behavioral, about his cognition and behaviors. And so because it wasn't working, he was written off. It wasn't helping him. Since everything had been tested for and done, he's obviously fine. Charles is milking it, eating poorly, not taking his medication on time, not applying himself, not pushing himself, faking it because he's comfortable with the sick role, and so on. Translation: it's his character that's the problem. So when a kid doesn't fit the intervention, they're the problem, not the intervention. So these are critical times of nearly unbearable pressure for anybody, but for the junior and senior in high school, these are actual quotes from parents. And again, this isn't to impugn anybody. I'm not here to judge anybody or say how terrible they are, but these are the things that get said to kids when they're misunderstood and their issue, their symptoms are seen as behavioral and willful. You must take the SAT. You'll never get into college. Just try. Junior year is most important. If you blow it off, you will have dug a very deep hole and time is ticking. Well, you're blowing your chance at a scholarship. How will we afford college now? You have extra time. What's the problem? You have to try a little too, And because teens are foundationally viewed through a behavioral/adversarial lens, remember that first slide? Well-meaning people heap the pressure on using the woodshed and schoolhouse tactics. The woodshed, where you go to get whipped, and the schoolhouse where you go to learn a lesson. Woodshed or schoolhouse tactics. Another critical time of nearly unbearable pressure for preteens and young teens heading into high school. These are, again, actual quotes from perfectly nice parents who just didn't know what was going on. Come on, you have to get used to the hallways in the cafeteria. We'll just practice. Find clubs you like. You have to make new friends. You can have a fresh start in high school. Try not to get so worked up and you'll feel better, which is kind of like stop bleeding and you won't die. You better get your sleep schedule in order because you have to be up early and better not miss the bus. And this is all appropriate if infection's not causing the symptoms and the subsequent behaviors. So these are things that sometimes need to be said or gone over with a kid. But if there's something else going on, like an infection, it no longer fits. So here are the messages Charles internalized when all was said and done. Everything had been tried, and that must mean nothing can help me, and I will always feel like this and probably get worse, because he was feeling progressively worse over, an extended period of time from freshman year to junior year. There's nothing for me going forward in life. My friends are disappearing. I can't even function. What's the point? I've let everyone down, and it's not looking like life is worth living anymore. And being written off can lead to writing life itself off. There's a lot of talk about suicide, teen suicide as well. There should be. But we need to expand the lens and look at what might be going on with the differential diagnosis. And that's not happening yet in our larger systems from what I can see. But I think if we start to look at these things, we just may see a difference in the suicide rate. Anyway, moving on. Here's a recipe for suicide. Take a young person who feels ill, become tired of them always having issues and express exasperation about their obvious love of the dramatic and attention seeking, suggest hypochondria. Get them to places for help and explain if the help isn't working, it's their fault. They need to try harder. Keep pushing and warning of certain doom and failure that awaits if this keeps up. Use examples of peers or siblings who are excelling and going places in life. Warn them that the train moves right along without you. I've heard that used for more than one kid. They don't even know each other, and it's over, several years in between them. The train will right along without you. Make it all about their attitude and character and cooperation. Do not drink a culotta. I had to get that in there. I had a girl a few years back, severe migraines, joint erosion. Literally, her shoulders and elbows were eroding, depression, memory problems, headaches, complete insomnia. I mean, all kinds of crazy symptoms. That did end up being due to a tick-borne infection. But anyway, talking to her dad, nice man, he said, well, I don't know what you think's going to happen. She drank a culotta on Monday. You can't drink a culotta and be healthy. So a culotta was, the culprit in her long litany of horrendous symptoms. Anyway, point out that everything has been done and they have to step up to the plate and make an effort and repeatedly repeat. So here's another referral. This is Danny. She was referred for management of severe bipolar depression, making poor friend choices, possible drug abuse, sporadic school attendance, rebellious behavior, anger management, ignoring classwork and assignments. The reason was cited as her parents' divorce. They were going through a divorce at the time. The becauses nearly always come with teen clients. That's the thing to be addressed in counseling, the becauses. Very often I'll get a referral and it'll be, well, here's what's happening, and it's because of this and because of that and because of this and because of that. Fix it. So I'm thinking about the becauses because Danny was loaded with them. So she came to me with migraine headaches. Those were because of hormones, severe insomnia because she was on the phone too much, truancy and lateness because of her troubled boyfriend, depression and mood swings because of the divorce and the bipolar, not doing schoolwork because she was getting careless and lazy, vision problems because she watched too many videos, chronic fatigue because she never sleeps because of the phone, relapsing mono because of kissing the bum boyfriend. A word of caution about the becauses. I sort of covered it, but they really galvanize and they become these immutable laws that become established givens. So if you mention a hormone panel or testing, oh no, this is because of this, this is because of that. The introduction of possibilities for symptoms and behaviors is then met with sometimes really spectacular resistance once a because has its barbs well into the situation. Nope, it's like this because it runs in the family, or I have these problems and it's because of this, because of that. The lens through which things are viewed narrows to include only the because and any possible tactics to address the because. So people become very bent on this is what's happening, this is why, and let's fix the because. So in Danny's family domain, the parents blamed each other. Mom said dad ignored her, and dad said mom indulged her. And they were like the immovable object meets the irresistible force. They were both very stuck on their respective point of view. The focus was on her friend group as the problem. Everybody was very focused on this friend group. Danny was choosing friends who understood her, and most had identified as depressed and or bipolar. So she was building herself a support system. She wanted to find affirmation in her friend group. Many circular fights ensued around the friend group. Yeah, the family really felt about this. Oh, these bum friends, you were in with the misfits now. What happened to you? That sort of thing. And she had an older brother who was a super achiever, and he was always on hand to lecture and talk to her about her brattiness. And, they were a large, loving family, but just everybody knew what the becauses were, and it was like a feeding frenzy. They would contact Danny and talk about her attitude and what she needed to do and how she needed to change. She was reminded that she was given a clean bill of health when she talked about feeling sick and headaches and dizziness and stomach issues. and she needed to stop with her complaints and stop kissing her boyfriend. They don't listen to kids, they don't. All right, so in an educational domain, Danny received 504 accommodations due to her bipolar and anxiety. Was periodically referred out for drug testing due to the glassy look in her eyes. Her pupils would dilate. That's not an unusual or uncommon symptom for people with tick-borne infections. Danny wasn't working to potential. Danny was becoming school avoidant. Danny was at risk of dropping out, and she was. Danny became insubordinate and hostile when confronted, and she could. She was tired of being bugged, and she would blow up. Not irrationally, but she would be a little fireball, and I think that's what got her through, really, in the end. Danny needed discipline and a firm hand. No excuses entertained. So tighten the reins. That horse is obstreperous. Tighten those reins and don't let her get out of hand. In the social domain, Danny was very much a realist and a tenacious coper. She still is. She sought to connect with others who understood her situation, people with similar issues. She used to be an academic, very much an avid reader, very into social sciences at an early age. She saw no point in that anymore. Her memory wasn't working. Her brain wasn't working. Her friends were people she could identify with, people who could support each other crisis to crisis, people up at night like her and didn't tell her she was making her issues up. That was critical. To the casual observer, Danny looked like a rebellious teen looking to get away with things. Again, that list of things assumed about teens. She was warned about her reputation, which prompted her to become angry in defense of her choice of friends. So it's become quite the hairball. So here's the medical and mental health domain. Danny was diagnosed with mono in 7th grade and experiences what were called relapses over the next few years. Danny was also diagnosed with bipolar and migraine headaches with visual disturbances, and it was decided that she was likely taking illegal drugs along with her prescribed meds. Even though she never tested positive, there was just no other explanation for the look in her eyes and mood swings and so forth. Partial programs and alternative school placement were recommended along with antidepressants and mood stabilizers. Danny was dumped out of bed in the morning several times by crisis teams. This is the thing. I've been in the field forever, since the early 80s. And the 80s were like this 21 Jump Street tactics that dump the kid out of bed and yell at them to get real and confrontation and get in the hot seat. It was a hot mess. I don't know what thinking went into that. Anyway, dumping out of bed still happens. It's a thing in some places. Danny was treated like a difficult discipline case. Cognitive behavioral and group therapy, structured school setting were recommended. And Danny is by nature a cooperative person, but she didn't do well when she wasn't heard and was given to very explosive reactions when she thought something was dumb. She's a highly intelligent girl. And, was just, why won't anyone listen to me? And don't you understand? I would love to get up if I could, that sort of thing. She failed IOP and completed her partial program, but still felt awful, despite a reasonable measure of compliance with treatment. Danny's takeaway from her experience was that nothing could help her. She'd done it all and saw so many others who were also unhelpable. That's the subject for another day. She concluded that the mental health and medical systems are to be avoided at all cost. She was a disappointment as a person and would never be good enough. There was no point to applying herself to anything because it would never be good enough, and she always felt bad. And she also concluded to not tell people outside of her friend group what's going on because helpers will only ignore, dismiss, or overreact. Okay, so the eventual outcomes were both kids got to, the term is Lyme literate doctor, but I don't know about that term. I mean, it fits, it's a description, but I think that a doctor who viewed them with a broader lens and was willing to look at current available research and use labs that use a more sensitive diagnostic surveillance criteria. So anyway, they got to doctors who diagnosed and treated them correctly. So we'll leave it at that. Eventually diagnosed with Bartonella, Babesia, and Borrelia. So that's Charles. treated with a combination of antibiotics, antimicrobials for 8 months, utilized cleaner eating and detoxification strategies, and Charles saw a dramatic improvement of psychiatric and physical symptoms. He is now in college majoring in computer science and working part-time during the school year. Danny was eventually diagnosed with Bartonella and Borrelia, treated with a combination of antibiotics for about 2 years, maybe a little over, it doesn't matter, about 2 years. Utilized detox protocols and made dietary changes, and she saw a complete resolution of psychiatric symptoms and dramatic improvement of physical symptoms. She is now in college abroad studying to be an archaeologist. So she's digging stuff up somewhere in, I think, Africa. Not positive. No, it's Africa. So I have some additional observations. There's a tendency for kids to grow so accustomed to feeling bad that days when they don't feel as terrible, it gets called better. I'm better. I'm now better. When a kid reports feeling better, well-meaning people tend to start pushing because after all, he or she is feeling better. Got to catch up. Oh, now you can get your work done. Catch up. You got to do this, got to do that. So it's best to explore the report of better and see what that actually means. Help the kid process the situation and work within themselves so that they're not set up for a failure. So rushing only serves to compound a sense of defeat and despair because they want to feel better, And when they'll look for anything, okay, so I can get out of bed. This must mean I'm better. Here's another thing. Because symptoms wax and wane and kids want to feel good and participate in life, there are times when they will do things to engage in life. Often interactive video games will allow, quasi like a type of participation because they absorb all the senses, are controllable, and ease loneliness. This typically gets pounced on as proof that they're feeling fine and are milking or faking feeling ill. When screens are involved, and they do bring some complication to the table, the screen typically gets blamed for all things. I capitalize that because it's like, see that? Those computers, and the kids are using them too much, and I gotta go. I mean, I agree there is, such a thing as too much screen. I'm not saying there isn't. But again, if it's the only connection, the only kind of manageable thing a kid can do for a little bit, it for a season, it does help the isolation. And it does, allow some level of stress reduction, but it has to be worked with and, looked at carefully for what it is. So how to help in the family domain. Assume the best about the kid. Because something is hard to understand doesn't make it a character flaw on the part of the kid. Listen and receive rather than judge and direct. Advocate for the kid in the educational and medical domains. Avoid comparing to others who had similar symptoms but push through anyway. I see quite a bit of that. And I know it's intended to incentivize, but when there's a tick-borne infection or there's other kinds of infections that also create psychiatric symptoms, when there's a physiological cause for the symptoms, it does more harm than good to do that. Avoid sharing concerns over finances. This generates guilt and it shuts the kid down. We can't go to that doctor. It's so expensive. That sort of thing. Just put a lid on that. Don't put that burden on the kid. When the assistance sought is not yielding results other than embrace the illness, it runs in the family. It's all in his or her head. Be willing to explore possibilities that may not come with designer labels. Designer labels means there are many great treatment programs and things out there to help people. And we've got this hospital and that hospital and this university and that one and this program and that one, and they're good for what they do, but everything has its limitations. And no matter how prestigious the program or the institution is, it doesn't mean they know everything and are the place to get the help you need. So, look for messengers coming from places you least expected, I would say. Or at least be open to messengers that are not designer label. So avoid the ultimate write-off. When someone frequently has health issues that impact all domains of life, it's very easy to come to this fluster-driven conclusion. This is the way he or she has always been. I had an Aunt Gertrude who was like this, and she's the same way. And this is a very defeated place. And when you've been through everything, you think you've got all these answers, and you've got some answers, which sometimes get called all the answers. It's easy to go to that place. This is where the it runs in the family serpent gets its fang and venom into the equation. The person is then managed like a pain in the neck and solutions are not looked for. Yeah, sometimes things do run in families, but the various symptoms in family members can be caused by a number of different things. So when something runs in the family, if you've not seen the genetic testing and it's not a genetic condition, think long and hard about coming to that conclusion. So how to help in the educational domain. Avoid prescribed expectations based upon accommodations. Well, we gave you extra time on your test and you still didn't do it. Come on, meet us halfway. Sometimes halfway is still too far. This still makes it about the behavior and deadlines, which in the case of symptoms caused by stealth infection, cultivates a sense of defeat and despair. Believe the student when he or she tells you that they can't get up in the morning. Arrange for a later start of the day and don't confuse fatigue with laziness or irresponsibility around screens, even if screens are involved. That's a whole other topic. So don't fall into the time's up trap. If you went to the football game last week, you're better now. It's been a long time, and I think you need to push yourself, because this will wax and wane and go back and forth. The process of recovery, not only being sick, but the process of recovery is not an ascent, a consistent ascent. Here's more on school. Listen for secondary gain. When a student is frustrated with how they're feeling and has a hard time explaining it, that kid is not faking, milking, or creating their problem to get out of class. Like Charles, he was so involved in sports and theater. He was like, Mr., his name, fill in his high school name. He was getting absolutely nothing out of his symptoms and the behaviors that came with them. He was very, very depressed about them. As wonderful as school nurses are, and I have school nurse friends, I love them, they're not in a position to diagnose and decide a student's not experiencing or creating their symptoms. They're very busy. They're inundated with paperwork. They're inundated with unreasonable expectations. I know this. And when a kid comes in and they're frequent flyers, repeat offenders, however you want to put it, it doesn't mean they're creating their symptoms because the cause isn't readily visible. There's going to be good days, bad days, better days, worse days for as long as it takes. The kid is scared enough thinking that things will never change. They don't need character assassination on top of that. Resist focusing on and meeting deadlines or else. Assure the student that things will be sorted out one way or another and they'll be okay. And they will. Last bit of school. You can tell I worked in a school, can't you? I've got a lot to say. Never bring up another student who has similar symptoms, who is doing X, Y, or Z. Sick students feel bad enough as it is, and a misguided attempt to incentivize using peer references is cruel. It's not intended to be cruel, but it is cruel. The takeaway for the student is not only do I feel bad, but I'm a wimp on top of that. They see their peers moving along and living life and want to be part of it as well. Comparing only serves to increase despair. Let the student know that school is a resource for learning, not a rat race to be run tightly monitored by stopwatch-wielding officials. Kids often perceive school that way, and when ill, become intimidated and anxious about it. They feel like losers and will never catch up and have no future. From there, suicide easily becomes an option for some. They will not be written off at school. So for help in the social domain, understand that cancellation and limited contact is not personal. Some behaviors, like having to leave a movie theater because it becomes too stimulating or avoiding pep rallies, commonly occur. And it's just too much light, noise, it gets overwhelming. The brain is inflamed, so it becomes unhappy, and the kid may feel like they need to get out of there. If the experience reported seems too hard to believe, do not discount it or suggest sucking it up. It's okay to disbelieve something, but not okay to determine and dictate another's subjective experience. It's very important. Even if you don't believe it, reserve judgment, and you can't say, well, that's not really happening. I think you're exaggerating, because really you're not in a position to do that. No one is. Encourage and uplift a friend by accepting what they can do, no matter how minimal. Avoid trying to incentivize by reporting to them what they're missing. You know, people mean that, oh, you're going to miss the game. So-and-so is going to be there. We're going to do this. We're going to do that. It's well meant, but ouch. So they will not be written off. Helping in the medical and mental health domain. Evaluate using a panoramic lens. It's helpful to use grade level to mark time when ascertaining a health history. When I'm doing an eval or taking information, I will ask using grade levels. What was kindergarten like? Anything disrupt the school year in any way? What about first grade? Kids and parents tend to remember things better if they relate to a relevant, prominent life domain. This paints a clearer picture and gathers more information. So they can remember second grade, oh, we missed a month because of X, Y, or Z, or that was when this or this happened. So grade levels tend to be a nice little framework from which to ask questions. Avoid giving the impression that treatment can be failed. Unfortunately, this happens a lot to teens. Still feeling bad after intensive outpatient program, IOP? Well, you didn't apply yourself. Medication's not working or making you sick? Well, you need to give it time and stop eating junk. Sometimes it can be the case, but it's important to look at the whole picture and not have a prepackaged knee-jerk answer. More about medical and mental health. Avoid trying to make the therapeutic or medical relationship fit a current model or intervention or treatment. All modalities have value, but their limitations are not the fault of the client or patient. So if you do CBT, wonderful, but if it's not suitable for a client, it doesn't mean that they're doing something wrong. It means it's not what they need. When working with children and teens, consider whether you're influenced by common assumed truth about kids, and if so, consciously listen past those assumptions. Assure kids that you will help them problem solve, and if you don't have sufficient solutions, you'll help them in the process of finding them. Much assurance is needed to assuage despair. They will not be written off. Here's a recipe for suicide. Okay, this is the same one again, so let's go over it one more time. Take a young person who feels ill, become tired of them always having issues and express exasperation about their obvious love of the dramatic and the attention seeking, suggest hypochondria. Get them to places for help and explain if the help isn't working, it's their fault, if they need to try harder. Keep pushing and warning of certain doom and failure that awaits if this keeps up. Use examples of peers or siblings who are excelling and going places in life. Train moves right along without you. Make it all about their attitude, character, and cooperation. Do not drink, oh, remember that culotta. Don't drink a culotta. Go to hell in a handbasket if you drink the culotta. Point out that everything has been done and they have to step up to the plate, repeatedly repeat. Very dangerous. And here is a recipe for self-preservation. Take a young person who feels ill. Assure them that some answers take longer to find than others, and you'll believe and support them any way you can. Assure them that one way or another, educational needs will be sorted out, even if it's an unconventional process. Assure that he or she will not be written off. Repeatedly repeat. And that's all I have. This recipe for self-preservation goes a long way to lift up, encourage, and maybe even save a life. Thanks for listening.